popular speaker at TLC events and has been for years. He is extremely active in the fields of cognitive behavioral therapy and psychology, both in New Jersey and nationally. He serves on the Science Advisory Board of the International OCD Foundation. He serves on the local board of the local OCD affiliate in New Jersey, as well as many other activities in this field. I'm particularly happy to say that he was one of the members of the very first training classes that TLC ran back in 2003, our professional training institute. That was the very first professional training institute, the first professional training in the field, specializing in the field of BFRBs ever. And so Alan has been a really dedicated professional in this field for a very long time now, and we're so grateful that he makes himself available as a resource to us. So thank you, Alan, and I'm going to turn it all over to you now and look forward to hearing your talk. Thank you.
Thank you, Jennifer. Hi, everybody. I forgot about that I was in that very, very first training program. And I just remember that at the very end, I think it was Fred Prinzel or Charlie Mansueto had said to all of us, you are now the most formally trained people for BFRBs on the planet. And that was just such a cool thing that they had said it that way. Okay, so I can't see myself on the screen here. So Jennifer, I'll just ask you to interrupt and let me know if for some reason I veer off and you can't see my face. So let me first tell you what I'm not going to be focusing on during this presentation. And I'm not going to be focusing on so much on the treatment of trichotillomania and dermatillomania because there's so many other presentations that really cover that. This is very specifically going to be focusing on how parents should be dealing with their kids who have this problem, how they should be responding to them specifically. So this is not about doing the therapy per se, although of course I'll be making reference to some of the things that we do when we have this program, when we employ the programs for working with the problem. It's really going to be more about dealing with the children as parents. And before I even start this four-step approach that I have outlined here for you, let me do a couple of small background slides. So you should have the next slide on your screen. Background and general treatment issues for pediatric trichotillomania. So especially for younger children, they may not be as self-conscious. So, with kids who are 8, 7, 6, or 5, especially, these kids don't have the social sensitivity sometimes where they really don't care if people are going to respond to them in a negative way because they look different from picking their skin or pulling their hair, or they may not, even be aware of the fact that people would react at all. And so that makes it difficult when it comes to motivating them to work on the problem. Kids also, in general, at all ages, have a more limited expressive ability, which may hinder identification of issues. In other words, they just can't talk as effectively about what is going on for them. And so that always makes it more difficult to work with when you're trying to change a behavior like this. There are, of course, when we're talking about children and adolescents, issues around independence and self-determination. And they're more acute at very specific kinds of ages, 4, 5, 6, and then there's another bump in early adolescence, and then there's another bump in later adolescence. So, but all along the lines, there's always these problems. It isn't the same as working with another adult in the family that has these difficulties. And of course, related to that is the issues around parental boundaries and authority and control, which may contribute to confusion around parental response. Parents will come to us and ask, how far should I push? Do I punish? Should I be yelling at them? Should I be threatening them? Or should I just be letting them go and do this stuff to themselves and really be struggling with how much of a parent should I be when it comes to these kinds of behaviors? And we'll talk very specifically about that. And one of the other background slides that I wanted to just touch base with you is the idea of having a contract to communicate. So I have on top there, set it up so that you are more likely to be able to help your child respond to a trick episode by doing the following. What I mean by trick episode, and again, you can always substitute pick for trick if the children that we're talking about are skin pickers as opposed to hair pullers. Ask your child to let you know when he or she feels like a strong urge to pick or pull is coming on. Now, sometimes they won't even be able to do that, but this is a way of helping them and guiding them towards self-awareness and then being able to intervene before the problem actually plays itself out. Explain beforehand how you will respond and help, and explain that if your child is not aware of engaging in the BFRB, again, that's body-focused repetitive behaviors, for those of you who aren't familiar with the term, that you will respond anyway if you see it happening. So if I see you pulling or picking, I'm going to bring that to your attention. Sometimes it becomes difficult because it becomes a real pain, and the child feels like they're being, nagged a lot, and then you have to kind of renegotiate. But the bottom line here is what we're trying to do is basically set things up so that you talk to your kid about what it is that you're asking of them and what it is that you're going to do beforehand, not in the middle of having a trick episode, or also not just responding without having this kind of contract laid out there. So there's no surprises. They know that what you're doing is something you've already talked about, and you have a sense that you've already discussed it with your child as well, and that you're kind of following a protocol. Much better than just reacting in the moment. Okay, so this is the program as I've laid it out. Very specifically, when a child is having a trick or a pick episode, there's preparation, and that has to do with beforehand, identifying and anthropomorphizing the trick. I'll talk about what I mean by that. Empathizing with the child, reminding and encouraging the child to challenge the trick, and then reinforcing and redirecting. And then I have a couple of special issues on the bottom: the unmotivated child, the aggressive child, and the at-risk child. Well, let's get started with these. Preparation. Identify and anthropomorphize the trick. Anthropomorphication is just a fancy word for bringing human qualities to something that is not human. So for instance, if somebody's complaining about their car, which is not starting up in the morning, and says, oh, she's just being temperamental, well, the car is not a she, and it's not being temperamental, it's a car. But we like to give human qualities to things that aren't human because it just helps us to relate to them, to actually have relationships with them. And that's what this is about as well. It's about having a relationship with the trick or pick problem. And let's talk about what we mean by that. That means that you're basically labeling it. When a person has an urge to pick, child has an urge to pull, you're basically saying that is your trick problem, or your pick problem that's trying to get you to do this habit that you're trying to not do. It's like this struggle between you and this other entity. Now, sometimes it's necessary to clarify. They wouldn't really think that there's another person, or that there's a monster, an animal, or some kind of bully that we're dealing with. But it's just an interesting way and an easier way to respond to this urge by making it another person. Also, especially with kids, this helps to concretize, make more concrete what is going on in their heads and in their minds by sort of externalizing it. For parents, it's really important because it reminds you that your child is not really misbehaving here, but he or she is sort of under the influence of this force that's trying to get her or him to engage in these behaviors by making him or her very uncomfortable until he or she engages in that behavior. So one of the ways that we do this is we name it. We give it actually a name, and we have kids draw their trick. Sometimes we refer to it as the trickster in a lot of the presentations that I've seen, or the pickster, but actually give it a name. So I have an example here. This is a 12-year-old girl drew this. She named this thing, whatever it is, Scooch. And here Scooch is saying to her, you do what I say. This is a girl who did a lot of skin picking. And you could see on the bottom that it's by, and I just crossed out the name. I covered the name so you don't see that. And when we talk about drawing or labeling and naming the trickster or the pickster, we say it could be a boy or girl, a man, a woman, an alien, a monster, or anything in your possible imagination that you can come up with. So it's a real good creative way. A lot of this stuff is really about just kidifying therapy. It's about making it something that is more comfortable in their language. Now, this is usually really good with kids up to the age of 13 or 14. Sometimes when you get to kids who are 15 or older, they're just a little too cool to engage in this kind of thing, and then we'll just call it, the trickster, or just trick or pick. But especially for kids who are a little bit younger than that and going all the way down through grade school, this is a really good way to have them get a good sense of what this enemy is that's really trying to control them. I alluded to this before as well, and I also want to mention here again that what this does is it allows parents to kind of see the problem as this, in this case, scooch. And so it's not about getting angry at your kid. It's not about wanting to punish your kid. It's about wanting to engage with your child to join forces against this other enemy that's really making everybody in the family unhappy. So there was labeling, naming, and drawing it. And then over here, I have identifying it and differentiating it from you, quoting it, basically saying things like, that's your scooch trying to make you pick at your face. And so you talk about it as a separate thing, who's saying, something like, you pick your face now, or I'm going to make you uncomfortable. You're not going to be able to do your homework. You're not going to be able to focus on class. I'm just going to get in the way and make you very uncomfortable until you take care of this. And so you want to create this sort of adversarial dialogue where you're teaching the child how to respond to these forces. So this is a good example of drawing that. So here, Scooch is yelling at the girl saying, you better pick or else, and that's her name, which is why I crossed that out. And she says back, no, I won't listen to you. I can imagine you big or small, and I can get rid of you by imagining you away, Scooch. So this whole sense of having this conversation with this force that is trying to control you is really very important. And we'll act it out in the session sometimes. We'll like role play and switch the roles. So they tell me what Scooch will say, and I try to show how they can respond, and then we switch roles. So there's, again, what you're trying to do is find, it's basically doing therapy in kid language, turning everything into as much of a game as possible, and also by concretizing it, by bringing it outside of their head and making it this physical thing outside of themselves. You really make it a little bit easier for kids to get a sense of how they need to be thinking about this and how they need to be responding to this in an attempt to try to control their own behavior. It also makes them feel less bad about themselves. They're still responsible to control their behavior and to fight Scooch or whoever, but it isn't as if they're really being bad kids. You're always reviewing a game plan in advance, as we talked a little about before. And the whole idea here is trying to have as much as possible a collaborative approach. This is not about dictating as a parent or as an adult about what your child should be doing, but rather talking with them about what it is that you're going to try to do, have them try to agree as best as possible. If there are things that you want them to do or to work on and they're not ready to agree to that yet, be a little flexible and kind of go with whatever it is that they can agree with to start. And as you begin to have that working relationship around this, you can build from there. So that's the whole idea of setting it all up. So once this ends up happening and your child, you can see that your child is struggling with picking or pulling, or they've come to you to say that they're having difficulty. If they haven't and they're just doing it, what you're doing is you're identifying it as such. That's why it says identify and saying, oh, I see that that Scooch is giving you a really hard time, or the trickster is giving you a really hard time because you're pulling at your hair, you're picking at your skin. So you're labeling it, you're identifying it, and then you're empathizing. And here you're spending a lot of time really focusing on what the kid is going through by sharing your impressions, by getting them to talk as much as they can about it. And let me give you some examples here. So first, a general statement about your relationship is always a good way to start. I love you very much. I care about you very much. And I see that you're having a hard time. This also is a good way for parents to kind of step back and chill out a little bit and calm down and remind themselves that this is not about you against your child. It isn't about your child acting out against you. This is about you loving them very much and being concerned about them and doing your best to care for them and helping them to care for themselves. So you ask questions. You try to engage with them through active listening. What are you having difficulty with? Tell me what's going on. How are you doing with it? Let your child express in his or her own words, and then you reflect back. So I see you're having a really hard time. Label the emotional experience and join with your child. So there at the bottom, this must be very hard for you, very frustrating for you. I would think that you're probably angry, or maybe you're feeling ashamed or embarrassed, or maybe you're scared or afraid, or maybe you're feeling very sad, or you're feeling very distracted. And so the child is feeling very, very listened to and very, very supported by, and not so alone in all of this. Plus the fact that when you lead them in the direction of starting to challenge their pulling and picking behavior, you've already joined with them. So they're much more willing to hear what you have to say rather than just shut you out, close down, and withdraw, because you've already joined with them and also engaged with them by having them talk out loud about their emotional experience. So for many reasons, it's a really important step in this process. Okay, so you have the preparation in terms of identifying and anthropomorphizing the trick, and then you're empathizing with them as we just talked about. And of course, even if they're yelling or they're angry, we'll talk a little bit more about this later. You can also do that empathizing. I know that you're upset because you're just feeling so frustrated. Sometimes you have to do a little interpretation as a parent, not take things personally, which is really hard to do. And try to make the focus on the child and being there for the child. Ultimately, that is really the best way to help them learn how to control this behavior, by being on their side. We talk about parents as being the coach, because you really can't fight the fight for them. But if you think about a boxing ring, what ends up happening is the child is sitting there in the corner and you're the coach kind of massaging their shoulders and giving them a drink of water and, giving them some pointers. Then you send them back out there and they've got to fight the fight, because you really can't fight the fight for them. It's really, really difficult. But that's really the limitations that we have, and that's the boundaries that we're talking about here, where you're giving them the support. You're a really good coach or cheerleader, but you can't control exactly what is happening here, which parents find very, very difficult to accept sometimes. And that's really the challenge of this whole presentation, recognizing the limitations that we have as parents to really save our kids from hurting themselves in this way. So once you've identified, you've anthropomorphized, you've empathized, you let them know that you're on their side, that you're for them, you remind and encourage them to challenge their picking and pulling behavior. So let's divide that up into reminding and encouraging. So first, in terms of reminding, the best way, you always want to try to get your kid to be the one that's more involved in what is going on here, unless you lecturing at them. So Socratic questioning is always better if you can manage that. So what you're doing is you're asking questions so that they come up with the answers of what they need to be doing or how they need to be thinking about the particular situation that they're in. That's true with just about anything when it comes to teaching your kids stuff. So it's a good thing to keep in mind in general. But in here, you're basically saying, do you remember what it is that you need to do in terms of dealing with this problem when you have the urge to pick or pull? And if they don't remember, then you want to give them cues. Well, what did you read about in that book that we were looking at? What did you talk about in therapy the last time we were there? Which of the exercises that you've been working on might apply here? And what did we say you should try to do when we talked about it previously? And so in all of these things, the parent is not giving the answer to the question, what do you do? But rather trying to elicit the answer from the child, because the more you can have things come from the child, the more likely that they are to apply it. They own it. It becomes part of their agenda. Not only that, you're also training them to better be able to think about these things, to become aware of them, and to remember them when you're not around, to catch them in the middle of doing it, when they're on their own. And so there's a lot of reasons, again, to try to get them to really come up with the answers on their own. Of course, before I get into that, of course, ultimately, if they just say, I don't know, I don't know, I don't know, and they really don't want to spend the effort or the energy to try to come up with the reasons, then with the answers, then you kind of can remind them of some of the interventions that you might have talked about or that you might have learned about in therapy, you might have read in a book. And I have some references at the end to share with you that you can then address. But again, as I mentioned, I'm not really focusing on the treatment per se as to how you use, once the treatment is known, how as a parent you coach your child through this process. In terms of encouraging, I know you can do it. This is about being a really good cheerleader. If you get the response, it's too hard, it's too much, how about let's just get started and see how it goes? One of the best ways of trying to just about anything that's challenging but seems really big and overbearing is to just get started. It's to, that old Chinese proverb, the journey of 1,000 miles begins with the first step. or one of the things I've seen is the secret to great success is getting started. And it's really just about looking at, let's just do this for like a minute. Let's just try this for 30 seconds. Let's just do this one time and just get things going. You know, the metaphor is that it takes a lot more gas to get a car to go from 0 to 10 and then 20, then 30 miles. But once you're going 60 miles an hour, to coast at 60 takes a lot less gas. You've already got the momentum. Same concept here. Do you remember how things worked out the last time you fought back or applied strategies or challenged the trick or the pick? Most of the time, the answer is that at least to some degree, it was helpful. Even if it wasn't 100% completely helpful, usually it's not as bad as it would have been had you not tried to apply some of the strategies. So you're always looking for where the power was, where the positive change was, even if they ended up actually picking and pulling the last time they tried to apply whatever skills they've learned. Review techniques if the child is unable to remember or is unwilling to put the effort into remembering, as I mentioned a few minutes ago, and then offer to model the skills for your child. So, you know, for those of you who are familiar already with the treatment for trick or pick, we borrow a lot from comb theory for adults, but really the book, I'm blanking on the name. It's at the end of it's Ruth Golem, and I'm blanking on the second author, but it has to do with fiddling sheep, and the whole idea of there's a picture of a sheep with a fiddle, and it's really a representative of the 6 areas that you're focusing on: fiddling, having something to play with your hands, and then the sheep is an acronym for stimulation on your body, and for habit, and for environment, and for emotions, and then for the P is for the perfectionism of the hair that's shorter or longer or more curly or just, you know, has a different feel to it, or maybe even a different color to it, and the skin where there's a little piece that's hanging, and I just want to make it all nice and smooth, and, you know, that perfectionism piece that's a little OCD-ish, you know, there's a little bit of that gray area. There's separate disorders, but there's some overlap that you'll see. And for each of those areas, there are different techniques and interventions that we utilize and that we apply to help the child address that aspect of why they're picking or pulling. But again, that mostly goes beyond the scope of what we're trying to do here. Remind and encourage to challenge, and also we review and we model the skills. So some of the overall skills that we talk about are basic, simple things like change the setting or leaving the room that you're in, because a lot of times there's environmental cues that are stimulating the urge or triggering the urge to pull or to pick, or change something in this one, change something in the room. Or the place that you're in, just so there's a different setting, and maybe just sitting in a different chair. If kids tend to pick or pull while they're lying in their bed in their room, or sitting at a desk at their computer, change it up, move around, move your body. Delay or postpone. So a lot of times it's a lot easier, or should I say better, it's a lot less difficult to say, okay, I really feel I need to pull. I'm just not going to pull for the next 30 seconds, rather than say, I'm just not going to pull at all. You know, it's the whole concept with alcoholics of one day at a time, where I'm just basically chunking and dividing up into small pieces the act of not engaging in a behavior, but for a smaller period of time. And then we try to make it 30 seconds into a minute, into 3 minutes, into 5 minutes, into 10 minutes, longer and longer. And the idea is that if you wait long enough, the urge to pick or pull crests and then begins to come down. Engage in a substitute or incompatible behavior, and this has a lot to do with like fiddling sheep. So for instance, with fiddling sheep, the fiddling pieces, we have them have a lot of the fiddling toys, and that's just, again, part of the treatment. It's much more complicated than just having something to play with. But the whole idea of engaging in one of the behaviors that we talk about, an incompatible behavior would be, you know, a drawing or writing, so that you're using your hands, or going on the computer so that both of your hands are being very busy, or even for some kids it's just sitting on their hands as a way of helping them control their behavior. Engaging in grounding or tension release or relaxation techniques. So this habit reversal training, HRT, is a term that you might have heard about. And there it's really about idea of tensing parts of your body, taking a breath in, and then relaxing and letting go. There's a lot of very interesting things that I've come across in working with kids and adults over the years who pick and pull. People come up with really inventive things. One of the things that I really like that I just want to share with you, it's not even really part of this presentation, is this whole concept of doing the following. And I do it with kids, and they really like it. That is, they take a piece of ice, small little ice cube, and they put it in their hand, they hold it over a sink, and they hold it for as long as they can as it melts. And of course, what that does over a period of time is it actually ends up hurting, but it's not really damaging the child in any way. But it creates a certain level of pain, and really what you're doing is it's a test. How long can you hold on to the ice cube? But when you hold on to that ice cube and your body reacts to the uncomfortable pain, there's a physiological change that takes place in terms of tension, in terms of body chemicals that are released. And so you're physiologically changing your body in ways that sometimes interrupt that urge to pick and pull. Doesn't always work. Or if it does work, it doesn't always work every single time. But again, it's one of those tools in your toolbox. And these are the kinds of things that you can remind your child of or try to elicit from them when they're having trouble and you're trying to talk them into remembering what are some of the kinds of things that they can be doing to kind of interrupt this process or even preempt it if they haven't started yet. Address emotional state or express their feelings appropriately. And so here also what you're doing is you're getting the kid just to talk about their experience. So much of the problem of trick and pick has not to do with the fact that a person is pulling or picking their hair, pulling at their skin or picking their hair. It has to do with the shame and the embarrassment and how bad they feel about themselves for doing this to themselves, for watching themselves do this to themselves. And it's really the shame and the embarrassment that interferes with their ability to function and makes them withdraw and makes them depressed and creates a lot of the emotional sequelae, the after effects that kids struggle with when it comes to this problem. So we can't emphasize enough the issue of addressing those problems, the emotional after effects of picking and pulling, and not focusing always so much just on how many hairs have you pulled or how much of your skin have you picked at today. Reinforce and direct is the fourth area there. So we reinforce the success at not pulling or picking, but also, even if they have picked or pulled, any real effort that they've actually made. Find success, quote unquote, in all previous attempts. Be a good cheerleader, verbal, social, but also concrete, a privilege or gift, something specific, as a way of reinforcing them. And then especially for older kids, but for youngers as well, token economy. And that basically means, the whole stars or the chips that they can cash in for something with a delay as age appropriate. So the older the kid is, the longer they can wait to cash in their chips for something. It's very hard for a 5-year-old to wait like a month to get reinforced for not picking or pulling on a particular day. Usually for kids that old, you really want them to get something very specific by the end of that day at the latest. Older kids, teenagers, can definitely wait longer, if that makes sense. And then related to this process of the 4 steps, you then redirect them by engaging them in a new activity or alter the activity that they were doing or even returning to the previous activity. In other words, just kind of get them back on path of whatever it is they were doing, whether they were watching a movie, or whether they were working on their homework, or whether they were whatever it was that they were doing, to try to just sort of re-engage them back into regular life. All right, so those are the 4 steps. Again, identifying and anthropomorphizing the trick. So this is your trickster. This is Scooch, who's trying to get you to do this stuff. Talk about how difficult it is for them, how sorry you are, how much you care about them. Remind them and encourage them to challenge the trick and try to use Socratic model by eliciting it from them as much as possible. And then when they do whatever they do, even if it's a small token thing that they do, reinforce that. Make it a positive experience. Don't focus on what they haven't done in terms of employing their skills. And don't focus on what they have done in terms of their pulling or picking. It's about trying to make your interaction with them during these periods of time as positive as possible. They already feel bad enough about what's going on. This may not always be true, especially with some of the real younger kids, but especially for the pre-adolescent and young adolescents and older adolescents. they are already beating themselves up plenty. They don't need you to add to that, because then they end up feeling like they've disappointed you as well. Let's talk a little bit about these three groups of kids who may provide some very specific challenges. So for the unmotivated child, parents ultimately are the ones to identify the existence of a BFRB. So the kid who basically says, I'm really not doing it, but they are, ultimately you're the boss, and you say that this is a problem. I'm seeing you doing it. I'm seeing the after effects of it, and so this is really happening. Frame the first session as an interview. If you're working on trying to get your child to go into therapy to meet with somebody, and of course someone who is TLC certified is always going to be one of the best, try to frame that first session as an interview, that they're interviewing this person. We're just going to go check this person out. We'll ask them some questions, see if we like them. It empowers the child. It isn't so much like taking the kid, like the kid's being sent to the principal's office because they are they're in trouble. And it's a lot of times I have kids who come to my office, and that's really the flavor of it. And then I have to kind of do a lot of backpedaling and reinterpreting and redefining, because it's not about that. This is about, you're here because you're hurting, and your parents know that you're hurting, and we want to see if maybe this is something that can be helped, and maybe I can be the person to help you. And this is about the child and the parent checking out the person, the therapist, to see if this is somebody that they're willing to come back to. And in the same way that we talked about, doing things one step at a time, this is the same kind of thing. You're not saying, okay, you're going to go to therapy for the next 6 weeks, twice a week to work on this problem. Let's just go one time and check this person out. If they're resistant, explain that you go to the therapist alone and then do it. And why that's important is because you don't want them to control you, the child, and say, well, we're not going to even deal with this problem at all. But on the other hand, you don't want to really force the child. You don't want to make them, because then it's all going to be, it's heavy-handed. It adds to more resistance. It's always best, of course, to engage the child in whatever we can. This way, you come in on your own, and you learn what it is that you can do to try to engage the child. A lot of the stuff that I talked about today, for instance, might be some of the things you might learn with a therapist on your own if your child is not willing to go to therapy. Educate about possible sequelae, the natural consequences of the problem. The whole idea of what do you think is going to be happening, whether it's with skin having to do with infection, or with scalp having to do with infection, or the way that things are going to look, or what are they going to do during the summer when it's time to go to the pool? Really have them begin to think about what, not so much as a threat, but just, I'm concerned about you. I mean, have you thought about what's going to end up happening when you're not wearing, the big heavy hats anymore, or when, when you're not able to wear gloves outside because it's not going to be cold anymore, that sort of thing. Or maybe you're going to be wearing a sleeveless blouse or shirt, or short sleeve shirt, and you won't be covering up the skin abrasions. Motivate by reviewing rewards for trying, so that they know in advance what it is that you're going to try. You're going to try to, and is it bribing? Parents say, I don't want to bribe my kid, and I'm like, look, what do you want to try to have happen here? Pull out all the stops. I'm not saying spend a fortune, but it's about really this kind of token idea of, I'm really behind you. I'm so proud of you for trying, and I'm recognizing your efforts by providing you with this gift. Monitor your own boundaries and expectations. Really what it comes down to, and we tell this to parents all the time, it's really hard to hear this, is if a kid really doesn't want to do this, you really can't stop them. It's really, really difficult to swallow that. But ultimately, it's about trying to do this in a way where it doesn't become toxic and noxious, to talk about it, to address it. Because as long as you can make it a positive experience, they're much more likely to come back to you when they're ready. And again, there's a couple of exceptions when there's issues of health, which I'll get to. The aggressive child. There we just talk about reviewing healthy anger management techniques, and there's just a quick list of a bunch of them. Writing, drawing, breathing, breathing exercises, exercising, trying to get the body go, punching a pillow, throwing a ball, using words to talk about how frustrating or angry they are, trying to distract them. Some of these things will work better with younger kids than older ones. Using imagery, and I mean that in lots of different ways, whether it's, just thinking about something different, one of the relaxing scenes kind of thing, or just trying to empower them in different ways. And then other kind of exercises, again, things like, holding that ice cube is also another way that we deal with anger management sometimes. Limit setting, review details in advance. Basically, what you're trying to do is you're basically saying to them, I really want you at least trying to work on this problem. And if you're not even make the effort to work on this problem, then there may be some consequences as a result of this. And I always try to avoid that, but if parents really feel that they need to exercise some kind of control because they're really unhappy with what the kid is doing to themselves, then we talk about doing this. And I'll talk about it in a minute, just about what that means and how that works in terms of following through with consequences. First thing is you want to present as a unified parental unit. A lot of times there are problems because there's the good cop and the bad cop, the good parent and the bad parent. And then they are at each other. And a lot of times kids will kind of push that because they figure if the parents are busy arguing with each other, they can kind of slip into the background and the parents will stop bothering them with whatever problem they're bothering them about. And so you want to have a discussion beforehand, you and your partner, about what it is that you're going to say to the child, and then when you do it, you say it together. You're both there, so that there's no what we call in psychology splitting. And then you follow rules for consequences, which means they need to be immediate. Not again, this bad thing is going to happen, and you won't be able to go to this thing a month from now. It really should be as quickly as possible. It should be short term. Because you don't want to punish for a long period of time. You want it to be relatively short term. It has to be age appropriate, of course, and it has to be easily enforced because you don't want it to be something that you have to watch them now for the next who knows how many hours, and then you're punished as much as they are. For, again, pre-adolescents on up, usually, having them lose their cell phone or computer privileges or screen time for a specific period of time is one of the easiest things to do. But sometimes just like for an hour or even 20 minutes, because for some of these kids, as you know, their cell phone is like air, and if they don't have it for 20 minutes, you're sending the message home. I'm really disappointed that you're not willing to at least make the effort. Now, this is not doing things because they have been picking or pulling. It's whether or not they're engaged in treatment, whether or not they're trying to work on building their skills. It's not about punishing because they have picked or pulled. That's never the focus of those interventions. Follow through. But again, the focus is always on their efforts here as well. And so whatever positive you can find it, focus on it, reinforce it. The at-risk child, there's really two major areas that we're talking about. That's infection from picking and pulling, and then trichosomars, which are these balls of hair that get caught up in the intestines when kids have been eating their hair. And most of the time people will flat out refuse to admit that this is what they've been doing, that they've been eating their hair, even when they have been. And so it's all about, trying to elicit that as much as possible, make sure that their bowel movements are fine, make sure that their appetite is normal, that their weight is normal, because those can be very, very dangerous. And so in those situations, we get a little bit more heavy-handed because it's health, it's wellness, it's safety. So it's about explaining up front about your concerns in an age-appropriate manner. This is not about punishment. This is about the fact that I love you very, very much, and I'm really, really scared for you and very concerned. Applying the guidelines for the aggressive and unmotivated child that we talked about already. Monitor it a little bit more closely because this is a safety issue. And so you may be a little bit more of a helicopter parent for this, but again, safety issues. So the rules are bent here a little bit more. Make consequences more severe and more immediate. But overall, still, you're maintaining respect for the child at all time. You're trying to avoid judgmental or aggressive attitude. You're trying to empathize with them as much as possible. You're trying to express concern and caring at all times, not only so they can hear it, but so you can remind yourself what it is that you're all about, why you're doing all of this. This is about me being a loving, caring parent, not me being frustrated with this rotten kid who's just not listening to what I'm telling him or her to do or not do. Okay. So that's basically it. This is who I am. Again, we are Stress and Anxiety Services in New Jersey. We're in Springfield, New Jersey, and in East Brunswick, New Jersey. We do cognitive behavioral therapy for OCD, social anxiety disorder, panic disorder, phobias, and other related disorders, body-focused repetitive behaviors, and everybody on my staff is TLC certified, I'm very proud to say. And that's our website down there. Ooh, you know what? I guess I didn't have the references here. I could put that up later, and when you access this, I can talk with Jennifer about having a few of those things. Although, TLC has a lot of information online. So having said that, I guess we can open it up, Jennifer?
Sure, great. Thank you, Alan. Thank you so much. That was really interesting. It might be easier. I don't know if people need to see the slide. If you put it back onto slideshow mode, then they won't be seeing uh,
Sure.
your whole screen, but not a big deal. Thank you. So for anybody who came on in the middle or after my introduction, I just want to remind you that if you have any questions at all, you can type them in. You can share them with us, and I'll ask Alan your questions right now. Um, on your control panel, there is a tab towards the bottom that says questions, and that is where you can type in any questions you might have. I know I have a few. So here we go. Boyd asks, should both parents be equally involved in this process, or should one be primary in order to avoid the child feeling ganged up on?
Okay, that's a great question. Every family has its own dynamic. Typically, it's really difficult to have both parents be as involved as each other, either because one has a different kind of work schedule than the other and is less available, or for other reasons. I don't think it makes that much of a difference. And this idea of being ganged up on, I think that when we talk about setting the consequences or setting the ground rules or sitting down and talking about what we're going to be doing, that's when I really feel that both parents should be there. When we talk about just about anything else that I talked about today, in terms of the Socratic questions or the empathizing or the redirecting, the 4 steps in general, well, actually the 3 of the 4 steps, the last 3 of the 4 steps, I think that's perfectly fine, having it be one parent at a time. The only thing I would suggest is that when there's one parent that's involved in some aspect of this, they make it their business to report to the other parent what has happened, so that both parents always know what's going on, even if they're both not there.
Thank you. Susan has what sounds like a painful situation going on. She writes, our daughter just turned 18 and has been pulling since about age 8 or 9. Initially, it was just the eyelashes, then the eyebrows, and now it's the front of the scalp as well. We've tried hypnosis, various SSRI medications, and meetings with a psychiatrist, therapist, and psychologist. I got her an app to track her pulling and took her to a TLC seminar. Nothing has helped. She does not seem to care. Her friends used to tell her she looked unique. She says she is not aware of the pulling until afterwards. She spends most of her time in her room, so we never see her do it, but can see the after effects. We are at a loss.
And this is tough, and we do hear this story often. The main thing is everything that you do and everything that you say should be in the service of trying to help her feel as little pain as possible about having this problem. Do not try to guilt her or manipulate her into working on the problem. You can let her know that you feel sad. You can let her know that you feel concerned. But at the same time, you should be encouraging her to engage in social activities, to not withdraw if you feel that's what she's doing. And if you feel that she's doing that because of the hair pulling, then it's about trying to utilize that as a way of motivating her to try to continue to work on the problem. There's also N-acetylcysteine, because that wasn't mentioned in the information that Jennifer brought up, which is an amino acid that I know has been brought up every now and then as something that might help. There's information, I believe, on the TLC website on that. But we do hear a lot about how the medications especially have been disappointing for people in terms of them being able to deal with this. I want to make a recommendation regarding the emotional sequela of this. There's a book by Fred Penzel called, is it The Hair Pulling Habit?
The Hair Pulling Problem.
The Hair Pulling Problem. It's a big text, and it's really everything you could possibly imagine about this disorder. But the second chapter is called The Shame of It All, and it's really all about the shame and the embarrassment of having the problem. And really, when we have kids who are just really unmotivated and they really don't seem to want to engage in treatment, then the focus really becomes on just making sure that it's not stopping them, it's not getting in the way, it's not affecting their self-esteem, it's not fueling depression, that they have a sense that they're loved regardless, and that there's always this positive sense that there may come a time down the road where you get connected with something that's going to be able to help you. There's a lot of people with chronic skin picking and chronic hair pulling that have tried, sometimes not the right people. But even when they've tried the right people, sometimes it's just so resistant, or they're just not ready for it. And you can't make it a battleground. I would try to deal with a lot of the things around the hair pulling, where I think you're going to have a lot more of an influence, like her lifestyle, her social world, her self-esteem, that kind of thing.
This, yes, this is a huge issue, the motivation issue, and there are a number of questions that circle around this, and I think that it can hit in different ways, at different ages. So Renee is asking, what if the child doesn't fit into any of the three categories mentioned? My child is kind of unmotivated, but not unmotivated to go to therapy, more so unmotivated to use her tools, manipulatives, etc. How do we help motivate them?
Well, you can use the old standby, which is some kind of reinforcement. And so whether it's a token economy or something that they can look forward to getting, or a privilege, something that is of value to them, then you can try to get them to work for it. That's always so much better than the punitive approach, where you're saying, well, if you don't do your homework, then your trick homework, then you don't get to watch TV or something like that. There's a real negative aspect to that we really try to avoid. So a lot of it also is really doing that empathy stuff. I mean, I tell people all the time, when they come in and they haven't done their homework, I'll say, I totally get it. It's like, you have a lot of things on your plate. You're involved in a lot of things. When you finally have a little downtime, who wants to spend time, thinking about this? Because if you're having a really bad day, you don't want to think about it more. And if you're having a really pretty good day, you don't want to rock the boat by thinking about it. So either way, it's like, it's a pain. It's like, you don't want to be bothered doing this. And even easy things like, we talk about having, 3 or 4 fiddling toys in 3 or 4 places, like in the car, in your book bag, by your bed, by the computer, by wherever you watch TV, wherever you have screen time. But even, setting up things like that sometimes, part of what that is, that sometimes is the resistance of, I hate the fact that I have this problem. And if I have to engage in these behaviors, then it reminds me that I have this problem. And I want to just not think about having the problem. So I think a really good way of dealing with that kind of stuff when it happens is, as a parent, verbalize all the things that I just said for your child. Let them see that you really get it, that it really sucks having this, that they hate this, they hate thinking about this, they don't want to be bothered with this. And once you go through this, then it's about just reminding them, but that I'm there for you if you want to make the effort and when you want to make the effort. I think that's your best investment. Mm. Not the perfect answer. That's really I'm
gonna ask my own follow-up question on which, as a puller myself, this one's real for me. Do you have any dialogue with children around the fact that most of us who pull or pick, to some degree, we enjoy the pulling and the picking. It feels good. We like it. And so especially with a little kid, you don't that can be part of the motivation issue as well. I don't want to stop. I'm enjoying this. Or even biting your nails. I want to get this. I need to fix this. Or, do you have any suggestions for that aspect of it?
Nothing that's unique and earth-shattering, I'm afraid to say. Again, sometimes the reinforcement can really help, but even when you do that effectively, they'll cheat, they'll do it behind your back, that kind of stuff, because they just really like the feel of it. And that really is, and that's one of the things, by the way, that really differentiates a trick and pick from things like OCD. Because with OCD, there's a release of tension, but you don't get necessarily that kind of pleasure. I always think, Jennifer, of that guy that you interviewed in my bad hair life, who was picking from his beard, and you asked him if you could just magically have the urge stop and not have the problem, would you do that? And he thinks for a very long period of time, and that hesitation captured so beautifully that aspect of this disorder, which really gets people stuck, which is they like the way it feels. Depending on the age of the kid, it's really about letting them know that you're concerned about what the sequela might be in terms of infection or open wounds, that sort of thing. Of course, if you are concerned about infection, then ultimately it's about, getting more heavy-handed, like I talked about. We have people, they're wearing Band-Aids, the kind of stuff that everybody does. That doesn't really work very well. But if you are monitoring very carefully and you're trying to use as many of the tools as possible that is available that you can sort of do to your kid, and again, we don't have time to get into a lot of those details, that's helpful. The main thing, though, I still come away with is try not to be negative about this. Try not to be too threatening about it, but mostly it's about just your concern and your love for your child, and ask, trying to explore if there are other ways that they can feel good or soothe themselves as a replacement for whatever it is that they're doing to their body.
Mm-hmm. Okay, thank you.
But it's very challenging, especially with the really little kids.
Mm-hmm. Mary Jo asks, what do you suggest for an 11-year-old who was pull-free for nearly a year and then began again a year ago? She's in therapy, but still not greatly motivated and secretive, doesn't want to talk about it, doesn't ask for our help. It's hard for us to celebrate her efforts because we don't know or see what she's doing to fight the trick.
Right. Okay, well, first of all, I would just let her know that. It's very hard for us to celebrate your efforts because, we don't see what's going on. But, she's at an age where she may it's really very important for her to have her privacy about this. And I would not tiptoe on eggshells around this. I would address it, and she rolls her eyes and she sighs and stuff like that. Well, then that's what she's going to do. I just wouldn't nag at her a whole lot about it. But I would bring it up on occasion. I would keep it in a live topic of conversation. And I think that the advantage that you have with her is you could say to her, you've had the problem in the past, and we know, not just theoretical, we know that you can lick it. We know that you've been able to somehow transcend it, using different language depending on the age of the child. And so any times in the past that someone has been successful, even for a relatively short period of time, she was pull-free for a year, but even for a relatively short period of time, that's something to capitalize on. You were able to do it. If you were able to do it then you're even better position of being able to do it now, because you're doing it now, you're moving forward now with the knowledge that you've been successful in the past.
Mm-hmm.
I used to work with smoking cessation when I did work for Johnson & Johnson, got me through graduate school. I used to go in during the lunch hour and do presentations, when people did end up slipping and going back to smoking, the response to that was just basically, it just means you needed one more quit than we thought before it was going to be the last one. Mm-hmm. It was as if you always needed 3 quits before it was final. And so you did 2, and you ended up slipping the second time, so this is going to be it. So it's just a way of reframing the way that you look at the experience.
Yeah. This is definitely a big theme. So it's so great that you're giving us some tools. Pam writes, I know what Susan is talking about, our previous questioner. I think the social stigma is not there for teens. This makes it difficult when teens don't think it is a problem, and sometimes it's a badge of honor. Can her trick be our problem, not hers?
Yes. That's my answer. Yes. That especially if you're not worried about her eating her hair, or you're not worrying about infections, that if she's really saying, I'm really okay with it, and it's not getting in the way of her doing anything, then you can express your concerns, but then back off. There's really there's no point in it. You're not going to convince her of it if you haven't been already. And I think that what you're getting at, Pam, is really one of the things about this presentation is really looking at yourself as a parent and recognizing your limitations in terms of being able to control every aspect of your child, and B, especially in situations like this where it really isn't a problem for them, and there isn't, again, the health problem. When there's the health problem, that kind of changes the rules a little bit. But if that's what they're going to do, then that's what they're going to do. And if you make it an issue, it's just going to make them feel misunderstood, and all the more reason for them to assert their identity by saying, well, I'm going to continue to do it because you're trying to make me not do it. And so, that's the whole adolescent thing that you want to try to avoid as much as possible. But it's a very astute observation, Pam. Hello?
Okay, hi. Sorry, I was pausing to read. I was making sure I hadn't already read this one. Lisa says, my daughter started pulling her hair at 16. She's completely resistant to therapy and even to admitting that there's a problem. She insists that she's got it under control. How do I begin a conversation with her? Anytime I try to broach the subject, she accuses me of helicoptering. I feel helpless.
Okay, well, first of all, that's not fair. If you're not really helicoptering, then it's not fair. And so let's talk about a little bit of the strategy there. First of all, when you want to have this conversation, you have it under optimum conditions. That means you let her know that you want to talk with her, without even getting into details. When is a good time? You're not doing it when the screens are on anywhere. You're doing it outside of her room, if possible. So there's a kind of a neutral space, the kitchen or, the living room. I mean, if there's siblings and stuff like that and there's less privacy, then I guess her room is fine. But you want there to be as little distractions as possible. You want it to be at a time when there hasn't been an issue, where there hasn't been an incident. So it's a time when there hasn't been specific picking or pulling, or there hasn't been other kinds of problems. And so you're coming to her in a situation that's very neutral, that's very calm. You're speaking slowly, you're speaking calmly, and you're talking about, the struggle very honestly. Things like, I know that you don't think this is a problem, and it's really hard as your parents for me to kind of step back, even though I really want to respect your individualness. I want, I like kind of the idea that you want to be in control of yourself and that you want to make your own decisions about things and that you decide when you're going to work on something, when you don't. I think there's something that's really strong about that. I think that will serve you very well in the future. But at the same time, I'm really concerned, and talk about what your concerns are. And so, the line is always, the more you treat your child as an adult, the harder it is for them to act as a little kid. And they really appreciate being respected and being heard. I mean, when you talk to kids as young as 10, 11, 12, but definitely 13, 14, 15, they talk a lot about not feeling respected, not being heard. They spend their whole lives following rules and doing the things that adults are telling them to do. And if you kind of turn that on its ear a little bit and just share with them the way that you would share with another adult this dilemma that you're experiencing and how sad you are and how frustrated you are and how hard it is for you, then you might find that you're tapping into these new young adult aspects of your child that maybe you didn't even know were there.
Thank you. Darcy writes, and we'll just do a couple more and then we're going to have to wrap up our hour. But Darcy writes, thank you for your
great questions, by the way, everybody.
They
Thank
are.
you.
It's such a smart audience here. Thank you for your presentation. My nephew's father's in the military and deploys often. He used to pull when his dad left and now pulls when he comes home. Do you have any suggestions for families with an environmental factor like deployment that won't change?
Wow. Okay. Well, I mean, clearly it's the change of him leaving and the change of him coming home and the stress, whether it's positive or negative, that is fueling this. In the fiddling sheep thing that we talked about before, there is the E, one of the E's in sheep has to do with emotional. We talk about emotional regulation. I don't know if you can see on the camera, but this is the idea that when a person's emotions are heightened, that they'll use picking and pulling as a way of kind of centering themselves and calming themselves down. On the other hand, if the emotions, if they're really bored, if things are really kind of low intensity, they'll use the picking and pulling as a way of emotionally stimulating themselves in a certain way, so that they kind of get this different kind of level of, they get to this kind of homeostasis. So it could work in either way. And really, a lot of the time, it's about trying to find alternative ways of meeting those needs. A big one, of course, is talking about it. Talking about it before the father leaves. Talking about it before the father comes home. And then discussing, if the child is feeling stressed out or concerned about whatever, other ways that we can address that. Ways of relaxing, of self-soothing, of calming down, or even of distracting. But it's about stepping outside of the problem of the picking and pulling and looking at the larger issue of these family dynamics and trying to find substitutes to try to fill the gap of that picking and pulling. Typically, you'll never fill that gap completely, at least not initially, because the person really has to come to rely on the picking and pulling, but it at least fill some of the gap and make the ability to control the behavior much more effective.
Yeah, it reminds me a little bit even of the cycle of kids often pull more during the school year than the summer, or maybe during certain times of the year. And just knowing ahead of time, the recognizing that cycle. I mean, you've already identified it. So being able to sort of arm yourself in a sense ahead of time.
Whether it's a behavioral problem or a psychological problem or a physiological problem, a medical problem, stress exacerbates everything.
Mm.
And so if a child has a picking or pulling problem, you can be sure that when there's some kind of change, when there's some kind of stress, that they're more likely to pick and pull during those periods of time. It's an opportunistic disorder. It tends to rear its ugly head when you're at your most vulnerable. So sometimes even when the person is bored and there's nothing else to do, or even if they're ill, or if they haven't gotten enough sleep, and they're tired, if they're compromised in any way, that's when sometimes you might see some of these symptoms emerge, even if they've been dormant for a while.
So we are definitely running over time. I am going to try to. There's a few other there's a number of other questions that have come in. A lot of them still revolving around this really difficult topic of motivation. So we may need to do some more, even follow up again, perhaps with another webinar, and continue to explore this topic. Another topic that is being broached, and maybe we can just address in brief, but I think it could actually merit a whole nother webinar. And we do have some information about working with schools, but and forgive me, I'm not sure if I'm pronouncing your name right, Arate, or she says, my daughter has been picking at school lately in specific classes. I've asked the teacher for help. She's willing to allow my daughter to have one fidget, but I feel she doesn't fully understand the problem. What can I do?
Well, if there's a way for you to have a meeting with her and educate her, that would be really great.
And we do have tools for schools. So there's lots of information on TLC's website, like specifically for educators. Because it is hard. Most people do not understand these problems and bring a lot of assumptions to their understanding, if they do understand them at all.
And a lot of they'll see it as just a behavior problem, and that the child needs to stop doing it, as opposed to a psychiatric difficulty that goes beyond just a habit. And so really educating them about this is really very, very important. We've had problems with, teachers in the past with that kind of thing, but typically they're very, very responsive once they really understand. And once the problem that we come across is the teacher will say, well, if they have that, then all the other kids are going to want to have that. And so that inequity becomes a problem that the teacher doesn't really want to deal with. And first of all, we found for the most part, it's not true. It really doesn't happen. But if the child feels comfortable in sort of coming out about their picking or pulling, and just to explain, I'm just doing this because this is what I do and I'm trying to control that behavior, and saying it very casually as if it's not a big deal, then it's not a big deal. But if it needs to be done, secretively, then, depending on the kind of things that you do and the kind of things that you have with you, it could be done more subtly. You don't have to bring a big, I know we had a situation where a kid went to school and he had the old, you don't see them very much anymore, but the old, the plastic little poppers, what are they called again, that they pack materials with?
Like bubble wrap?
They make noise. Bubble wrap, sorry. Yes, you can't do that in a classroom. That's crazy, But they were told that they could, bring fiddling things, but, clearly that was inappropriate. So it's about, being very subtle about it. You can fit something that you fiddle with in your hand in a way that you can even, pretty much hide it. And a lot of the habit reversal training exercises you can do without anybody knowing that you're doing it. So there are different things that can be done more subtly. But I think ultimately you really want to educate the teacher and have them be on board about this.
Right. Yeah, and there are, like I said, we have a lot of resources, and I would be happy to organize another webinar specifically about working with schools. But we do have some articles about if you need to get an IEP, like if you need to get special accommodations in the school, you can also go that's sort of the opposite way. Like you can either go very subtle, or you can say, look, this is, necessary. This child has a disorder and needs certain accommodations. And that can be formally done. And we do have information to help you understand how to go about that. The other area of questions that are coming in are just about how to find treatment, which is always an issue. And that's why we do these trainings like the one that Alan participated in. One parent's asking if you do Skype therapy, which
Well,
I don't know the answer to that.
There's a lot of people that I know that do Skype therapy. And I'm looking into that. There are barriers to that. One is Skype is really not the way to go. There's VSEE, because it's more secure, because this is private conversations and everything that goes out on the internet is always at risk. That's one problem. The second problem is whether or not you want to get insurance reimbursement, because when you're doing this kind of stuff, depending on the insurance reimbursement, a lot of them won't cover it. And then the third problem is that I'm in New Jersey. I'm a licensed psychologist in New Jersey. And so if you're outside of New Jersey, that becomes an issue as well. These are not, they're not laws that prohibit me from doing this, but there are no statements that specifically allow me to do this. So when we ask these questions from like the New Jersey Psychological Association, the answer typically has been, well, you could try it, but you may end up becoming the test case that goes to court if an insurance company doesn't want to pay, or if the licensing board wants to say that you're really not allowed to do this or something like that. So it becomes, very, at this point I tell people that if they use an encrypted program and they're not interested in getting reimbursement from insurance, and it's in, and you have a home address, a legal address that's in New Jersey, then really I don't have a problem. If it's other things, then we have to kind of figure out what we're going to do. The problem is that the politics and the organizations just have not kept up with the technology, and it's been around for a while now. So you'd think that it would have happened, but it really hasn't yet.
Yeah, that is an evolving field, and as you said, therapists are making all different decisions right now around it.
I will also tell you that ultimately when people call and they can't see me or they just have some questions, everybody on my staff knows to say, go to trich.org, trick.org. It is like the best resource on the planet for getting the information that you need to help with this problem from many, many different angles. A lot of different resources and meetings and stuff like that.
Thank you. Yeah, and I would just add that there are referral listings on our website, trich.org. And so,
are people identified, Jennifer, on that listing if they went through the TLC training or not?
Yes, if you've done our trainings, the Professional Training Institute, which is a weekend-long training, or our DVD version of that, it specifies what kind of training you've had, if any. So that can be one way, not the only measure of somebody's expertise, but that is one certainly, good one. So I would, a lot of questions like this, I do refer back to our website, and I'm so glad your staff does. And I am going to, I think we need to end it here. But again, I thank you all. I thank you all for attending. I thank you, as I said at the start, for your membership donations to our organization, because that's what makes all of the resources that you've heard about possible. The book that Alan was mentioning earlier is The Hair Pulling Habit and You by Ruth Gollum and Sherry Vavracek. That's a great book for kids, in my opinion. It's illustrated. It's a simple, if you wanted to, you can either use it with a therapist or as a self-help, it's written as a self-help book to use at home with your child. That's a helpful resource if you're really trying to tackle this at home and either aren't ready to work with a therapist or don't have one available, or for any number of reasons want to do that. And just stay tuned and we'll keep you posted on more resources. We will send you a link to the recorded version of this webinar so that you can listen to it again. And if you're a TLC member, then you have access to every single webinar that we've done, and we do them almost monthly. So it's an ever-growing pool of resources that you can log on and view as you need them. And feel free to send us ideas if there's a topic you want us to cover. Again, thank you, Alan. That was terrific. I thank you so much for devoting your
Thank you, everybody. Bye.
Thanks for being here. Bye, everybody.